Hi, this is Dr. Joe Colopy at Colopy Chiropractic and Wellness. Today we're doing an educational video on disc herniations. I have a model here to help me show the spine is made up of individual bones called vertebrae. They stack on top of each other like this to form the spine, and in between each one of those bones is a disc, a cartilage disc. It has two jobs: to be a shock absorber for the spine and to provide space for the nerves to make their way out. The spine is designed to surround and protect your spinal cord and nerves, so it has a very important job. A healthy spine means a healthy nervous system. A degenerating spine means an unhealthy nervous system. So we're going to look at disc herniations, what leads to and what causes a disc herniation, and what to do if you have one. If we take this model and we look over here at this marker board, we have the same thing drawn, the individual vertebrae or bones stacked on top of each other with the disc in between, the spinal cord running down the back of the spine, and the individual nerves making their way out. We take this model over here, we flip it, look at it from the top right here, and this is what we have the spinal cord running down behind the spine and the nerves making their way out. And then this big circle is the disc, with the center of the disc being more of a liquid or gelatinous center, and the ring, there's fibrous rings of cartilage that make their way around the outside of the disc and make it really strong, hold that more jello-like center in place. Now, what causes a disc to be unhealthy and become more brittle and tear easier, leading to a herniation, are misalignments of the spine, subluxations, and that is when the bones of the spine move out of their normal position, putting pressure on the disc, the joints, and the nerves, really negatively affecting the health of the spine. Being overweight, sedentary lifestyle, poor nutrition, bad posture, injury to the spine, diabetes, smoking, stress, lack of restful sleep all add up to an unhealthy spine, unhealthy disc. Unhealthy discs are more brittle and more likely to tear. That process of the disc becoming unhealthy and tearing and brittle is called DDD, or degenerative disc disease, which leads to your herniations. So most herniations, over 80–90%, are a process of degeneration of the disc, making it more susceptible to tears and then herniations. Very rarely is it the result of a huge traumatic injury. And so we're going to look at that process right now. So we go out on the weekends, or we lead a sedentary lifestyle, or someone unhealthy. We don't work out as much as we used to. We go to work, we sit at a computer. All these things negatively. We're subluxated, our spines are misaligned. All those lead to unhealthy discs. They start to get little tears in them, in these fibers here, and this jello center is going to start to bulge or push its way out through where the tears in those fibers are. This is what's termed a bulge disc. It's the stages before herniation. But if we don't do the right things to help stabilize and strengthen the spine, these injuries tend to just progress and get worse as time goes on. We continue to hurt our back and treat it poorly. These tears become bigger and bigger and bigger and progress further out toward through these fibers of the disc, and that bulge will get bigger and bigger, progressively get bigger and bigger and more severe, until one day it turns into a herniation from something simple like picking up a 18-pack of water at the grocery store. You lift that up, something you've done a million times, and you tear through those last couple of fibers of the disc, and it leads to a herniation. And that herniation can put pressure onto the spinal nerves or onto the spinal cord itself, just depending on where in that disc it's located. So what do you do in that case that you start to have that really bad back pain that's maybe radiating down your butt and the back of your legs, down even to your foot? Definitely, if it's radiating down to your foot, it may be an important time to go get an MRI. MRI and CT are the ways to see exactly what type of injury you have to the disc. If it's not made its way that far down the leg, then you know, an MRI or CT may not be prudent at that point in time. And so what do? Do you run off to the surgeon to fix your back? Real important things to consider. Research has shown that over 40% of all back surgeries are in a category called failed back surgery syndrome, which means the patient ends up feeling the same, with the same pain after the surgery, or even worse. So who wants to go into surgery and come out worse? Nobody. And basically what they're saying is that it's a coin flip when you do go in for these surgeries. Also, when they look at people who get surgery versus people who opt not to do surgery, and they look at that over an 18-month period, those people that did not get surgery favored just as well as those who did get surgery, if not better. So they get the same results 18 months out. They have recovered from those injuries that the people who went in to get surgery. The only difference is with surgery, if you are going to get pain relief, it's going to be more immediate, but you're still going to end up with the same result going conservatively. Then you've also benefit to going conservatively. You've learned how to strengthen and maintain the spine to avoid getting herniations and problems in the rest of the spine. Whereas if you just get surgery, you leave the problems that initiated this whole injury, and you'll end up more likely having herniations at other levels of the spine and ending back up under the knife. Statistically, that's what they show. Within 5 years, people who've had one back surgery have a second, a third, and a fourth, and a fifth. So some very important things to keep in mind. We have a lot of success treating people conservatively with chiropractic care and disc herniations. So if you're concerned about problems or issues with your back, don't hesitate to come to Colopy Chiropractic and Wellness.